For the future of AI in healthcare, do you see any risks at this point that kind of bother you, or you say, you know what, we should be careful about this, especially around health equity and delivery models moving forward?
There's a lot of talk about removing some of these old risk models that are out there that include things like race that maybe were based on bad patterns, right? So just because people aren't getting treatment does not mean that they are more likely to have a disease or less likely to have a disease, but it makes it more prevalent. It was a big point I think we saw with COVID around prevalence and incidence, and the statistics nerds, are all smiling right now because of that. But AI is taught by the data that we have. So we have to be really careful that if we build a model, we have to make sure we're building a model and then checking that model. If you're not familiar, a lot of the way that AI works, if it's going to spit out what's Al's, medical problem list, sure, there's something that generates it, but then there's a whole other AI that actually checks the first AI, right? So that's how they work. They check themselves based on referencing AI reads it and then checks it against some kind of static whatever, the rules. And those rules are the things or principles, guiding principles are things we're going to have to make sure we're looking at to make sure we're not racist and we're not biased. And we have to try to make sure we are not falling on the same mistakes of chasing zebras. As I learned in residency, it's never the zebra, it never is. But making sure we're not looking for zebras, chasing zebras, but also that we're treating all the people the same based on the true scientific data we have. Because if we train it on subset information and try to apply that to other areas, you've seen what could happen in some of these. It's like it immediately becomes racist. It says poor people are more likely to die of disease. Well, yes, because they don't get treatment. So we just have to be careful with a lot of those things. I think it's going to come in time. It's not something that's a doom and gloom and worry about, but it's that making sure in the beginning, in the next 2 years, that we're watching for those things and very cautious of those types of things. And making sure that we're all building appropriate governance. Because I think the worst thing and my biggest fear is that somebody's using something on their own phone that maybe isn't trusted. And because they think that it has AI attached to it and it's not a vetted, safe item, they're going to make really bad mistakes for that. And maybe people who are maybe not as educated in a certain area relying on things that aren't vetted and trusted, that's a big risk. And that's scary for me when I think about where we're at today and how fast things are moving.